things that you do you only see patients in like critical need? Because I was looking at the therapy.
Right, totally. Okay, I'll talk through kind of the options on what I do. I'll let you know some preliminary thoughts I have about your case, and then we can take that discussion from there. Within the interventional orthobiologics or the regenerative injections, whatever you want to call it, there are different types of injections we can do. A lot of the times my injection approaches are very similar. What changes is what's in my syringe. And what's in my syringe could be anything from dextrose, so that's our dextrose prolotherapy. It could be platelet-rich plasma or a variant of platelet-rich plasma, things like platelet lysate, platelet-poor plasma, or A2M. And then we have our cellular therapy. So that's our bone marrow and then our adipose tissue. So those are what people will generally call a stem cell treatment, although there's some debate on that terminology. But for lack of a better term, that's our stem cell therapy. The difference in those treatments is really going to come down to strength. So the higher up we go, so as we move from prolotherapy to PRP and then up to stem cell therapy, the strength of the therapy gets stronger such that we get better results with less interventions. And so an example is somebody who has more advanced disease. Doing a stem cell procedure might be equivalent to doing 3 PRP procedures, which could be equivalent to doing 8 or 9 prolotherapy injections. And so that's one of the reasons we might step up, is just because we're going to get a lot more accomplished with a single injection approach as opposed to having to do something, monthly 8 or 9 times, which some people, can't do because of travel or whatever reason. There is some major differences, especially when we move from the dextrose prolotherapy to the platelet-rich plasma. And the reason for that is because I actually don't do a ton of dextrose prolotherapy anymore, just because PRP works so much better and our results are so much better compared to dextrose prolotherapy. So dextrose is just one thing. It's just dextrose. There are a few things that the dextrose does in terms of healing. So it can stimulate some fibroblasts to heal. It can, or to secrete collagen. It can reduce some inflammation around nerves. Like, there's a few things that it does. Whereas PRP contains hundreds of different growth factors that are all beneficial to some degree in the healing process. And so we don't do a ton of dextrose prolo anymore because it took us a lot more injections to get people the results they wanted. And so for that reason, we predominantly just use platelet-rich plasma. And in many instances, we can have patients where just one treatment and it, improves their pain 70 to 90%, where we generally don't see that a lot with the dextrose prolotherapy unless it's something very simple like an ankle sprain. Like, I sprained my ankle, once a year and I want to take care of that. When we're dealing with stuff in the spine, our biologics, so our platelet-rich plasma and our cellular therapies, the bone marrow and adipose, are exponentially going to work a lot better.